So SisterReach is a reproductive justice organization, and we do comprehensive reproductive and sexual health education, policy, and advocacy work specific to women and girls of color, poor women, rural women, and the communities that they serve and live in. And for us, that also means men and boys. So we serve the full family at SisterReach.
Excellent. And when you're talking about the communities, is it Memphis specifically?
We are based in Memphis, but we do work all the way across the state. Unfortunately, we are the only reproductive justice organization in the entire state of Tennessee, and so that means that we have to take on the full state, one, to educate folks about what reproductive justice is or is not, and to definitely educate them on why we do the work that we do and why it's important for them to care about it. So SisterReach works mostly as an educator and an advocate. Our policy work is something that we're building more on. It's definitely the newer, more seasoned piece of our work, but a lot of our work means also routing women into different various care in the community, whether it's repro care or whether or not it has something to do with some type of social support. A lot of times we meet with women who are considering having an abortion, and we want to make sure that we're routing them to a place that is safe, a place that is affirming. Unfortunately, because of the hostility around abortion, even in 2016, it's important that that folks like us are here to make sure that there is some level of compassionate care from the beginning to the end of a woman's experience. And so us working with Provide actually in one role to kind of give them some insight about what that looks like of working in the South and what they should kind of be looking forward to dealing with, working specifically with their staff and giving them just some best practices as a Black woman leading an organization, working in really mainstream spaces, kind of the pros and cons of what that looks like. So working, almost in a consultant type of way, mentor type of way, colleague to colleague, just trying to make sure that their staff that works in the state of Tennessee kind of have a better lay of the land around the issues of abortion and abortion care or access. And so we have worked with Provide to make sure that the community advocates that we work with have access to learning about what it means to offer compassionate care and do compassionate referrals. And so that's been really key for us as far as that partnership, to be able to frame it in a reproductive justice frame. I think that makes it a little bit more palatable for folks when they think about all of the things that a woman has to go to even before she gets to the actual abortion.